All right. Good morning, everybody. It's 8:30. We'll call this morning's meeting of the Clay County Board of Commissioners to order for Tuesday, May 20th. Our first item is the approval of the agenda.
Move for approval.
I'll second the motion.
A motion by Commissioner Ebinger, second by Commissioner Mojo. Any further discussion on the motion? Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same sign. Motion carried. Citizens to be heard. Do we have any citizens to be heard on items not on the agenda this morning? I see there's none in the audience. Anything online?
Nothing, Mr. Chair.
Thank you. All right, we'll move on then to the approval of bills and vouchers.
I'll move to approve.
Second.
Motion by Commissioner Krabenhoff, second by Commissioner Ebinger. Any further discussion? Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. Approval of minutes from May 6th.
I'll make a motion to approve the minutes from May 6th.
Second.
We have a motion by Commissioner Bear, second by Commissioner Krabenhoff. I just want to make a comment, and the minutes are well done, Sarah. I knew being kind of new in this job now, but they're very thorough and very well done. I just wanted to point that out. So with that, any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. All right, item number 2, request approval to hire 2 deputy auditors and motor vehicle. Good morning, Larry.
Morning. I'm just looking to hire 2 new full-time deputy auditors in the motor vehicle department. I had 2 resignations recently. One's going back to school, and the other one's just moving on to a different opportunity. So requesting approval with backfill, please.
You don't see people leave very often.
Not very often, no.
Okay. Right, was that a motion?
Mr. Chair, I'll make a motion to approve that with backfill. Is that what you said?
Okay.
Second.
Motion by Commissioner Mojo, second by Commissioner Ebinger. Any further discussion?
Mr. Chair?
Yes.
Just to note, there was a time in which we were getting lots of calls regarding DMV, and I know that your staff works really hard to be as flexible as possible, but to address the needs of the community, and particularly with the new facility. So my phone does not ring with complaints about DMV, and that's a direct correlation to the work that you do, so thank you.
Thank you very much. And we actually get good compliments now rather than complaints. So.
Yeah, I tune into Moorhead Fantastic once in a while on Facebook, and it seems to me the Moorhead DMV gets good positive comments now. And
For the most part, they're positive. So.
yeah.
Mr. Chair.
Yes.
Just one question, since we have Lori here. It came to my attention, Wilkin County is discontinuing issuing driver's licenses.
I believe so, but I think they're still I think they're, the tab portion, I believe, is privately owned, I think. So I think they'll continue to do that, as far as I know, right?
You're not seeing a lot of,
Not so far, anyway. We haven't seen a big uptick on that.
Do you anticipate one?
I suppose it'll be a moderate, but I don't anticipate it being too much. I think they were only open 1 day a week, or they weren't open full-time.
Okay.
okay. Commissioner Krabenhoff.
And just a quick thank you. I had a citizen on the enhanced license, and I know you dealt with it very, very quickly, so I appreciate the effort. And also, I'm just curious, is that still an issue on the enhanced? Is there still big groups?
No, and to be honest, we didn't have those huge lines that you were seeing on the news.
Okay.
With all the lines, because we required appointments.
Yes.
So, people were trying to get those appointments, but they were pretty booked out, but
Yeah.
we weren't seeing those plump full reception areas during that time.
Okay. And is that demand kind of diminished now?
It has, it was kind of a panic. People thought they absolutely had to have it, but if you've got a passport, and there are a number of other IDs that will work as well. And so we've seen that demand or urgency drop.
Yeah. Okay.
The one thing that I hear is that people might not understand what documentation they need to bring.
Right, and that is
So when
on
they-
our website.
Okay, and when they call for an appointment, is that information given to them at that time then?
You actually make the appointment online.
Oh, okay, it's online, okay.
Yeah, but all that information is out on our website.
Okay. All right, any further comments, questions? Seeing none, all in favor of the motion signify by saying aye.
Aye.
Opposed, the same sign. Motion carried. Thank you, Lori.
Thank you so much, appreciate it.
You bet. Next, we have our Adult Mental Health Local Advisory Council Annual Report. We have Quinn, and we have Kirsten, Bree, and I don't see Allison here today.
Allison was not able to make it. Good morning, Mr. Chair and Commissioners.
Morning.
I do have Bria Kraus and Kirsten Lepard here. I'm going to turn it over to them. I just wanted to introduce them, but yes, Allison was not able to make it. Go ahead.
I'm Bria Kraus, so I'm with Clay County Social Services now as of about 6 months ago. And I serve as a secretary on the adult LAC now for a few years.
And good morning, Commissioners. I am just here to lend moral support to Bria. Like Quinn said, Allison was not able to be with us today, and our other co-chair is sitting up there with you. So I am going to let Bria do the presenting, and if there are any questions, hopefully the three of us can answer them.
All right.
Good. Well, on behalf of the council, we wish to commend the county commissioners on your support and previous investments in the mental health services, and the improvement of our mental health and well-being of those who reside in Clay County. I want to thank you for your financial support of the $2,000 from 2024, your ongoing investment and personal support for providing effective mental health services across the county has allowed many previous unmet needs to become met over the past years. The investments include ongoing inquiry and problem solving around current issues facing adults living with mental illness in our county. It's also provided, or will continue to provide, ongoing education related to the mental health and mental services across the community, networking with our providers and our community partners. The members of the LAC will continue to get stipends for events that they attend, the monthly meetings they attend, and that just has allowed them to have a greater understanding of the ongoing issues in our community. So thank you. And just a brief introduction, we all know mental health can be both positive and negative. You know, a lot of people have mental health crisis in our community. The mental health and well-being is important for all people, including individuals who do not have mental illness. The World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Most of what we're going to discuss today are the barriers, you know, the concerns that we talk about on a monthly basis between our community members, the providers, and family members experiencing mental health issues in our community. The first piece we're going to address are the crisis services in Clay County. We have two problem statements. The first one is the nearest crisis stabilization units are in Detroit Lakes, and that's at Willow Tree, and then our CBHH unit in Fergus Falls. Transportation to these units can be very costly and time-consuming. Gull Harbor in Moorhead here does have 4 licensed crisis beds, but the high demand of the IRTS program statewide has not allowed them to be utilized in this way. The beds are being utilized for people needing that intensive residential treatment service versus utilizing it for crisis beds. And so our recommendation is to streamline the networking and addressing the barriers for admission with Gull Harbor crisis beds that are available, as well as other crisis beds available in DL and Fergus Falls. The expected outcome is to reduce the costly inpatient psychiatric costs in Fargo, at Prairie, at Sanford psychiatric units. Utilizing this unit could also encourage the individual to seek help before hospitalization is needed. And so Gull Harbor does come to our meetings usually, but we do plan to kind of address what is the main barrier. Is it lack of staff? Is it truly the IRTS program that's taking it? The admission process is it's kind of confusing sometimes to providers. How do you get into Gull Harbor? You know, how do you access the crisis beds?
So I will add to that, I did have a meeting yesterday with Gull Harbor, and their crisis beds are being utilized. They do have one opening, and I did make a recommendation. Their staffing pattern has been difficult for the last probably 9 to 12 months staffing that, but I did put a plug that having a representative from Gull Harbor attending our LAC meetings on a monthly basis would be beneficial. So my hope is that they heard that and will start attending. It is helpful when all of the community providers can attend and just have a conversation about some of these barriers. So that's my hope.
Our next problem statement has to do with non-emergency medical transportation for people who are in crisis. It's individuals who are in crisis and need that non-emergency medical transportation to inpatient hospitalizations. Most of them don't have friends, family members to transport them. You know, they're relying on the ambulances for transport. Utilizing a cab service requires individuals to have enough funds on hand to take a cab to where they need to get to. A lot of our folks have insurance where they could set up a cab ride, but it does take a couple days, and most people can't predict when they're going to have a mental health crisis and set that up in advance. So the LAC recommends to create an RFP for outreach for utilization of protected transportation services. It's a state-administered non-emergency medical transportation level of service. It does have a few requirements, but it would be a provider certified by the Minnesota Department of Transportation as a protected transport provider. This would, the expected outcome would be a reduction in ambulance-related expenses for non-emergency medical transportation and leaving ambulance services available for emergency use only. They're short-staffed as well, and they're constantly being overworked as it is.
Are these for those transports to Fergus Falls? Is that?
Ideally, that would be part of it.
And Detroit Lakes, right?
Yes.
Okay.
The next problem statement has to do with the status of when a person doesn't meet medical criteria to stay in an inpatient psychiatric hospitalization. As soon as a resident no longer meets that criteria, the county is responsible for 100% of the costs associated with their care at the facility until another placement can be found, a lower level treatment that would meet their needs. Costs can be upwards $2,000 a day for an individual that the county will pay for. One individual in 2024, in just a 2-month span, cost us over $147,000 because another placement couldn't be found quick enough. And then in total for 2024, this cost was about $390,000 for our county. It just keeps increasing over the years. These dollars go right back into the state general fund and not back into our mental health system. So the LAC recommendation is to advocate to the state to dedicate greater than 50% paid by counties for clients that don't meet that medical criteria to build up our current mental health system, particularly in greater Minnesota, instead of putting 100% back into the general funds. We would advocate to the state that this revenue stream should be invested in stabilizing existing beds and lower level of care options, or increasing our state's capacity to meet the needs across the full mental health continuum.
So can I stop there for a minute? Maybe Kirsten or Quinn. So those two items where those recommendations are being made, and this is a recommendation to the state. Do we have these two questions? Are we presenting those to AMC?
I know MAAFPA is aware of the concerns about the fact that the DNMC costs go right into the general fund. It is my understanding that in years past, they've attempted to do some advocacy and some legislation there. I know that in 2024, 5, it didn't rise to management's priorities.
You know, if, to gain the most ground on things like this, if we can have these issues jointly worked on with AMC, it stands a lot greater, you know, option for success. And even with that, you know, those of us that serve on the different committees with AMC, we're, you know, by the end of our AMC policy platform, we're kind of dwindled down to where we get to pick like 3 to 5 things. That's, you know, that's how much demand there is at the state level. And so I think it's important, you know, so not being part of the AMC platform, I think could make it even more difficult to, I mean, certainly the recommendations can be made, but,
Right.
you know, we want these things to succeed. And how are we going about that? We can talk to our local legislatures and maybe garner their support, but still if we don't get the support, you know, from AMC, I think it's gonna be difficult. So I would encourage, that whether, I would imagine both of these would go through Health and Human Services. Is that yours, Paul?
Yeah,
So, you know, so we might wanna,
yeah. Well, I appreciate your comments, and, yeah, and certainly take that, and we can discuss making a deeper dive into it.
And Allison does sit on the State Local Advisory
Yes.
Council.
okay,
And unfortunately, she's not here to
Right.
talk about that and how they've addressed this. But in our meeting, she has stated that this is a problem area that they have discussed at the state level.
well, my guess is it's not a problem unique to Clay County. Right, so it seems to me that
Yeah, try to get the data, how it is statewide among the counties.
yeah, and then,
It's
you know,
big dollars.
try to get this,
Yeah.
the best way we can, I mean, you can recommend to the Clay County Board all you want to advocate for these things, but you know, then we need to make sure that we take that to the next level where it can have the support and backing at the legislative level, so. Okay, thank
We
you.
can bring that feedback back to the meeting today, in fact. So, thank you.
Yeah, so, you know, Paul, maybe you can, you know, when we start the spring,
Right.
platform issues, I think these should be brought up.
Yeah.
Okay. All right, thank you.
With those recommendations, expected outcomes would be to decrease the large expenditure from the county budgets that are impossible to predict. We don't know on a given year, on a given day, when someone's gonna be going into a psychiatric facility, and then they, you know, thankfully, they don't meet that criteria, they're stabilized, they're getting better. It would increase efficiency in the flow of patients out of hospitalizations, into more appropriate settings, and then more residents would be able to receive the level of care closer to home, hopefully. Housing is the next one. It's always going to be probably a concern that every county is going to bring up, but while navigating housing, clients are often faced with a lot of barriers. When a tenant is seeking housing, they need to fill out probably numerous applications for background checks at different places they apply for. To the management company. Typically, an applicant applies more than one location, and people in homeless and emergency shelters only have a timeline of about 30 to 90 days in one of those settings before they need to exit. So waiting for multiple applications and a background study to be completed often hinders that time limit. The LAC recommends that Clay County should advocate for the state to create a request for proposal for a business to develop and implement a statewide platform for the purpose of doing background and credit checks that management companies can all access. This platform would allow prospective renters to pay just one fee for adult members. The background we thought it could be valid for about 1 month in which the renter is applying. It could also be used by other businesses and nonprofits that need to do background checks on prospective volunteers, employees, et cetera. And we would advocate for a change in contract law to require management companies to utilize this platform. It would eliminate the need for tenants to pay multiple management companies for the same work, and it would be a quicker turnaround rate for clients to be housed, as people are often waiting at least 7 to probably 10 business days for those to be completed each time. That's just one small piece of the housing that we just tried to, what's one small thing, the county could advocate for. And then the mental health workforce shortage is another problem. I think we address that every single LAC meeting that I've been to. We talk about which communities or which agencies have wait lists, how long those wait lists are, what can we, the hiring process, where are we at? Over decades, Minnesota, we've all advocated for mental health awareness, attempting to eliminate stigmas, encouraging people to seek help when they need it the most. Our residents have been embracing this awareness and reaching out more and more every day for help with the hope and the expectation that they'll receive the support in a timely manner. More people are reaching out, but our workforce shortage can't keep up. And it's leading to decreases in mental health services in general. Wait lists are very long across the county. Clients are waiting 6+ months for any supports. And I wanted to give a quick example of, I'm in the adult and disability intake world upstairs, and I had a call just about a month ago, and he was in a pretty tough state. He was calling me from his closet, and he was having a mental health crisis. And I offered to assist him just, on a conference call, trying to get a diagnostic assessment set up with him to do that piece with him. We got through, and the first appointment that he could make was 2 months out just for a diagnostic assessment, and then was told 6 months later for his requested mental health services. So it was an 8-month span when he needed help, probably within the first week or two. He was absolutely devastated over the phone when he heard that, and a grown man sobbing on the phone. It was just something that hit me really hard. So this piece is pretty important to our whole group, when little situations come up like that, it just really hits. This is another recommendation that we do think that it does need to kind of start at that state level. Reimbursement rates for 2 particular services that are being requested most commonly are the adult rehabilitative mental health services and Rule 79 case management, and that's mental health case management. We have 2 agencies in town that can offer the Rule 79 case management for adults in this county, and they have very long wait lists. But those reimbursement rates would need to be increased for these essential services in order for staff members to be paid incentivizing wages. These are some tough situations that the practitioners, the case managers are working with every day, and there's high turnaround rates. People get burnt out. Sometimes when you have that incentivizing wage, it could help those employees remain employed with their agencies, improve efficiencies with wait lists. And the expected outcomes, more professionals would be able to remain in those fields while feeling supported by DHS. Clients would be able to start the requested services in a timely manner with more staff available. Avoiding potential crisis situations while waiting for services. Staff retention is also really important to clients. Clients often have to tell their stories over and over again to new workers, often that can trigger them and just kind of start that whole process over again with their mental health. The next issue we talk about, mental illness with co-occurring substance use disorders, so that dual diagnosis. Individuals who need those dual diagnosis services should be treated as a whole person. Our current system of separating mental health and SUD is not effective and leaves individuals bouncing back and forth between the 2 platforms. Our recommendation: encourage providers to honor a comprehensive assessment done within the last 6 months by a qualified licensed alcohol and drug counselor for outpatient or residential treatment placements, unless the person's treatment needs have changed significantly. We would encourage facilities to participate in programs specifically dedicated to treating dual diagnoses as well. We do have some, which is good. We do have some. Expected outcomes, they won't be repeatedly charged for the same assessments and get discouraged in their treatment journey, having to tell their story over and over again, once again. they'll be able to access treatment sooner by not having to wait for an assessment appointment. More appointment availability for comprehensive assessments for individuals needing assessment for the first time. Review of the need for treating co-occurring substance use and mental health next to the crisis center will keep the board and local decision makers aware of the spectrum of the mental health needs in our residents. And then just for time purposes, you can maybe read through the last recommendation on your own if you choose. That was just something not necessarily directly related to mental health, but just how to reduce waste in the public programs through technology. And then on the back, there's a list of our memberships and community agencies we work with closely. I want to thank you for your time, for listening.
Any questions?
Any questions, comments? Commissioner Mojo.
I have a comment in regards to the work. Thank you for really being thoughtful about identifying areas in which we can make a difference to help facilitate better support for folks with mental illness. Sometimes I really struggle with, one, we do have so much effort to pull together the data and the facts and the issues regarding it, but how do we make formidable change with that data? I mean, that's the part we struggle with. And so having this report is really helpful. And then it's really on the backs of all of us to bring that kind of to the decision makers that can make a change with that. I don't think it would be a waste of time if we were to forward this on to the folks on the committee we've worked with in regards to human services. I know that they're, with the end of session last night, timing's challenging, but I think in the off season, if you will, like Commissioner Campbell talked about, is how we make those really meaningful partnerships on areas that might not have been addressed with their omnibus bills yesterday. So, to framework it, to shift a little bit of the dialogue, maybe from less of a Clay County specific ask to more of that ask statewide, I think would be really helpful. And then two, working with the chairs who have both been to Clay County, I think are helpful. But two, thanks for having the dialogues, the monthly discussions. It's really helpful as we advance these issues, so thank you.
So I'm not going to lie, 2 weeks ago, when I was sat here and listened to the Children's LAC present their report to you guys, I was sitting back in the cheap seats and I was texting Bria throughout, like, has the adult LAC ever done this? What do we think about this? So we have some ideas that we're going to bring forth at our meeting today, so be aware, Commissioner Krabnoff, that we're going to throw some stuff out at the council. I was impressed with the Children's, how they had the data and the charts and graphs, which I know Quinn is a huge supporter of charts and graphs and data. And so that's something that we're going to look at over the next year to be able to provide you all with even more information to support the work that you do. So I just wanted you to be aware of that.
Thank you. Thanks.
Yeah, just a piece on, kind of a continuation on, and then I'll get to you, Paul. A continuation on what Jenny just talked about, and I'm going back and I'm looking at the business and development and the statewide platform for background checks and those types of things, and you look at one of the expected outcomes of it. I think that's important to, you look at, okay, well, this might cost this to do this, but what do you gain? And when you eliminate the need for tenants to pay multiple management companies for the same work, well, at the same point in time, I would think there's got to be an interest in some of these landlords. They would probably just as soon have somebody in those buildings and have them sit empty because they're waiting for, or these apartments are sitting there waiting for these background checks to come in. So they're, I see this, and I always try to think outside the box on some of these things, and I could even see Clay County reaching out to everybody all of our people that maybe accept the vouchers for rental units, to maybe to partner with Clay County in terms of if we can't do it at a statewide level, can we do it at a county level? And, you know, so I think, I don't think we should ignore that opportunity that goes out there. And I would think it's an advantage to those landlords to have somebody in those apartments sooner rather than having to wait. It means less vacancy time for them and an improved time for those residents. So I think there's a lot of things that we can even do, and maybe not even look, you know what, sometimes I think going to the state, it's wishful thinking. You know, by what you ask for and what results you end up getting. So there, you know, some of these things, if we can handle them at a local level, then I think we should do it. Paul?
Thank you again for your comments on that, and we'll certainly follow up on it. I think the one first of all, to the group that is active every month, there's normally 20 people at the LAC, I'd think any given month. One thing that's unique about the adult mental one versus the children's, we're about almost 50-50 on consumer being there as well as providers. So it creates a little different conversation than when it's all provider. And it's good to hear from people in the system, you know, kind of responses, and so I think it gives us a more realistic view of what they're going through that I wouldn't hear otherwise, because it's so much of this stuff is behind the scenes, it's private, you know, we don't know. And but the biggest one, well, not the biggest one, but a really difficult one we hear every single month, whether it's children's or it's adult, is the reimbursement rates, and especially in the way of Medicaid reimbursements, and they're so low that the providers can't do them without losing money, and that's just wrong. And so that is a piece we need to do on. I also want to recognize Lori in the background back there, who works for the county and works on Rule 79, 100%, and we always ask Lori every single month, how's it going? And she always has the same thing, my caseload is full. So anyway, we have great participation from the county, and I, once again, just am happy to be part about this, and do take the comments very seriously, and what you just mentioned, Kirsten, about kind of maybe reshaping how we form things. But, you know, the rental contract thing, that was the thing of Allison's been kind of bringing that up for a couple of years, and yeah, just step forward on a few things. So, yeah. Thank you all for your commitment and work that you do, not only for the county, but throughout our area, you know, with all our providers, and keeping that collaboration as strong as we can keep it.
All right, any further comments? We are looking for a motion to approve the Adult Mental Health LAC membership. And that's presented on page 27.
Mr. Chair, are these on terms, or how do these work?
My understanding it's every year, similar to the children's LAC membership.
So, under Clay County Board of Commissioners, do we list who the commissioner is on there, or?
It doesn't believe that we did, at least not in this page.
Okay. Because Commissioner Kravinoff, you serve on that, right? So.
Correct.
I'm on it.
We can add that.
Yeah.
All right, I'll make a motion to approve the list.
Okay. We have a motion by Commissioner Mojo,
Second.
second by Commissioner Ebinger. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. Thank you for your report. Very well done. All right, next we have a Measles outbreak update. apparently we're seeing some of that activity, and I've noticed Cass County. I don't know if we've had any in Clay County, but Kathy and Cheryl, you're not here to give us more shots today, are you, Cheryl?
No shots today.
Oh, we have somebody.
Left my needles in the office.
Good morning, Kathy. Do you want to do your introductions? Do we have somebody online too?
Mr. Chair and Commissioners, to the left of me is Cheryl, and you all know her, our extraordinary public health clinic and multiple other things that she provides services for. And then to the right is Liz, and she is our family health supervisor. And then online, we have Isaac Trebold. He is our West Central District epidemiologist, and little known fact, maybe Mr. Chair, you may remember, but Isaac was a Clay County Public Health employee here. And so he started out his career in public health here, and hence why he got moved to MDH, because he was started with one of the top public health agencies in the state. So
course.
I can say that, he cannot. So
I owe it all to you, Kathy.
we can't see his face because we
I
can't
do
see your.
remember Isaac.
But is it because we have the, okay, we have your slides, Isaac, so we can't see you, but we can put you on after the slide presentation. But Isaac did present to our Community Health Board just last week. And so he has some great information on our measles outbreak and updates. So with no further ado, I'll have Isaac get started.
Okay, sounds good. Well, thank you for having me, commissioners. So I can't quite tell who's in the room, so I apologize. But Kathy, am I able to share my screen? Will that work, or
do I?
Or do you just want to advance through the slides on your end?
Either one. What would you prefer, Isaac?
Yeah, I made a couple just tweaks, so maybe I'll
Okay.
try to share and see if
All right,
this
that sounds
works.
great. I'll have Sarah help here for a second. There he is.
I'm glad you didn't ask me to do that.
Okay,
So just,
so now we can see you a little bit, Isaac, so
oh, okay. Can you see my screen?
we can see your screen as well. Yes.
Perfect. Okay. So just give a quick update here of Kathy knew it was kind of be a gloomy day. So she said, let's have a ray of sunshine and talk about the ongoing measles outbreak in the country. So give a little update. So, use this graphic here because we always used to say measles was just a plane flight away and typically referring to international flights, but that's really not becoming the case anymore. So I wanted to give a bit of a 101 because a lot of folks haven't thought about measles or know much about measles symptoms these days. Measles is an acute systemic respiratory illness caused by a virus. It causes a high fever, a maculopapular rash, so that's kind of the dewdrops on a rose petal, so red and raised, and then the 3 C's, which are cough, coryza, which is just a medical term for runny nose, and conjunctivitis. Luckily, it is vaccine preventable, and it's one of our most effective and durable vaccines, 93% effective with 1 dose, recommended at 12 months, and then 97% effective after 2 doses, which are received at 4 to 6 years. And it's one of the most infectious diseases we know. It is airborne, and it transmits easily. Pardon my slides, they're having a mind of their own. Transmits quite easily with a 90% attack rate in susceptible close contacts. But if you were just to use the analogy of the commission room right there, if somebody was infectious with measles at that time, that room would have exposures up to 2 hours after they left that room. So it lingers in the air and causes a lot of exposures and subsequent illness. And it's quite serious. So, I think a lot of folks tend to think that measles is just a rash and a kid feels somewhat ill for a little while and then they get over it. But complications occur in about 30% of cases, the most common being, diarrhea, subsequent ear infections, and then more severely pneumonia and encephalitis. And what we see in our outbreaks here in the US is about 1 in 5 cases get hospitalized, sometimes a little more, sometimes a little bit less. It also can lead to really quite severe outcomes, including something called subacute sclerosing pain encephalitis. And this occurs in 1 per 100,000 cases, and it develops about 7 to 10 years after infection with the virus. It lays dormant and then causes this panencephalitis, and it's always fatal. Normal cases do lead to death in 1 to 3 per 1,000 cases. And there's no real medical treatment available. You can give medications for symptom management, things like Tylenol, antibiotics for secondary infections. And then there's been some talk about vitamin A as well. But most of the evidence for vitamin A comes from countries where a lot of children are vitamin A deficient. And so they have some benefit there just due to probably somewhat that deficiency, less so in the developed world. And it continues to cause a great disease burden throughout the world. 9 million cases worldwide in 2022. 136,000 kids died of measles that same year. And children in low-income countries have the highest risk of death. But what we've started to see, after the pandemic, is that we're seeing global declines in immunization. So not only are we seeing that in the United States, we're seeing it in France, we're seeing it in Southeast Asia. And the United States may lose our elimination status that we gained in the year 2000, meaning that measles no longer circulates endemically. But it looks like that this year might be the year that we lose that status because measles will again become endemic. Give you an idea of what it looks like from the time of exposure. So typically about 10 to 12 days before any symptoms develop. Those symptoms, again, that we're talking about, the fever, the 3 C's, the cough, cries, the conjunctivitis. Possibly after that, some complex spots or spots on the inside of the cheek will develop. And then that rash starts 4 to 7 days. Someone's infectious 4 days before that rash starts to 4 days after that rash starts. So when we're figuring out who's been exposed, we kind of have to use this timetable of figuring out an infectious period, then look at an incubation period, and then follow people that have been exposed for 21 days after their exposure to make sure that they don't develop symptoms and subsequently spread it to others. So one of the challenging things that have happened over the past few years in the outbreaks, we've had a few here in Minnesota, is that the rash is a little bit difficult to distinguish from other rash illnesses. So, a picture here of a few different types of rashes. You can see the child in the upper left-hand corner is, that's an allergy rash. And the other reason why you can probably tell that that's not measles is because that child looks like she's relatively happy or content even with that rash. Measles kids are quite sick and look pretty toxic. And you can see a couple rashes there. But the typical rash always starts at the head, the face, and then transfers down to the neck of the trunk and then to the extremities. Like I said, it's usually kind of got the dewdrops on the rose petal, not typically itchy, and these kids are pretty toxic and feel quite sick. So since 2023, we've had quite a few outbreaks here in the United States. Currently, in 2025, there's a little over 1,000 cases, including 13 cases in our neighboring North Dakota, and then 733 in Texas. And that's the current largest outbreak. The reason for this is obviously due to an introduction of disease, but also the declining rates in immunization. So the percentage of 2-year-olds who received at least 1 dose of, I'm sorry, my slides keep advancing automatically and I don't have a transition on them. But a percentage of 2-year-olds who had received at least 1 dose of MMR vaccine by 24 months declined about 5% from before the pandemic to 2023. And when we look at Clay County, if we look to see the children that were vaccinated before the pandemic, that's, still pretty high at about 91.4% have received one dose of MMR compared to a Minnesota average of 89. But when we look at the kids that are younger, so the ones that are about 8 months to a year and 8 months behind on their schedule, that number drops to 67.3% compared to the Minnesota average of 79.7%. So when those numbers are thousands of kids, all of a sudden you start talking about pretty large portions of a cohort that is susceptible to this illness when they typically wouldn't have been. So, it just provides a lot of kindling for this wildfire, so to speak. So one of the things that we have to do whenever we have an exposure is we have to look and determine who's immune and who's presumed immune. And that would be anybody born before 1957, anybody who's got a blood test that shows measles, IgG, anybody who's had laboratory confirmation of disease, anybody who's been documented that has received vaccines, and then other things like, say, proxies for immunity, like being in the military, have rubella IgG, or places that have required, workplace vaccinations. People who aren't immune, any infant under the age of 12 months, people that know they haven't received any doses of MMR, or people who are severely compromised are also considered not immune. So when we start talking about, exposures and what we have to do for exposures, so again, let's use our county commission meeting today. So let's say Kathy, again, has measles, she leaves the office or she leaves the boardroom. Then we're going to have to determine everybody that enters that boardroom for the next 2 hours. We're going to have to determine their measles status. We're going to have to notify them. And then if they aren't presumed immune to measles, we're going to have to follow them for 3 weeks to make sure that they don't develop subsequent illness. So not only is it a severe illness, but it's also a huge burden on public health infrastructure. I want to talk a little bit about the Texas and New Mexico measles outbreak because, quite frankly, this part of Texas doesn't look that different than West Central Minnesota. There's 718 cases across 19 counties, 74 cases in New Mexico. And again, a little over 10% of those kids that are hospitalized. Most of these cases are in Gaines County. So to give you an idea of what Gaines County looks like, they do have a large Mennonite population, and that's where some of this disease has been circulating, but certainly not all. Their population of about 20,000 have had 400 cases, and of those 400 cases, they've had thousands and thousands of other exposures. So it's a huge burden on the public health infrastructure, a lot of burden on the healthcare infrastructure, and a real challenge to find places to send. You have over 90 hospitalizations, a challenge to find places to send all these people, mostly kids. So that kind of gives you an idea of what they're working with in Texas and trying to manage there. So it's a real challenge. Now in North Dakota, we're kind of at the very beginning of a measles situation. So most of the cases are focused out in western North Dakota and Williams County, which is Williston. But there were 2 cases that are non-related to the western North Dakota cases that presented at healthcare facilities and resulted in exposures to susceptible individuals. So currently we do have 2 susceptible individuals that I'm monitoring in Clay County. So it's fortunate that it's only 2, but as you can imagine, the amount of exposures are quite, vexing. Out in Williston, they had about 180 kids in the school district that had to be excluded from school for 3 weeks after their exposures. So luckily it was, they'll be out of exclusion by the time that graduation rolls around, unless they develop illness. So again, a huge burden on a lot of things. I did want to bring up this article. So this is from the American Medical Association's journal, and this just came out last month. But it just discusses some of the things that we're going to start to see if we don't start to see a bit of an increase in some of our vaccination rates. And the modeling would suggest, according to to JAMA, that within the next 2 decades, that we'll hit somewhere around 1 million measles cases every year. And so, and that's, under current situations. If it gets worse, we're going to start to see, 10% decline. We're going to see many more cases than that. And we're going to start to see a resurgence in other illnesses, including rubella, diphtheria, and potentially even things like polio if we continue to see these decreases in the childhood vaccination rate. So unfortunately, I don't get to paint a very rosy picture for everybody today, but I just wanted to kind of give a heads up of what we're doing, for measles here at MDH and what we're kind of keeping our eyes on. So yeah, I can turn it over for any questions you might have.
All right, thank you, Isaac. Any questions? Yes, Commissioner Everett.
Yes, Mr. Chair. Isaac, in the event that a child gets measles and has not been immunized, does immunization at that point serve any function?
No, so if a child contracts disease, there's no point in immunizing at that point. For their close contacts, though, we do have an option called post-exposure prophylaxis, which, if given in time, we have 2 options. We can give vaccine to those, exposures within 3 days, and that should prevent illness, or we can give what's called immune globulin, which is just a blood product that contains measles antibodies, and that can be given within 6 days of the exposure. The difficulty with that is we frequently don't know of the cases immediately, so it takes a minute for them to work through the healthcare system, get reported to us, and so a lot of the time we're kind of behind the 8 ball, so to speak, on making those post-exposure prophylaxis recommendations.
Thank you. And to either Kathy or Isaac, if someone wants to get their child immunized and they don't have a pediatrician, what steps should they take?
Well, I just recently ordered additional doses of the measles, mumps, and rubella vaccine. And so once we receive that, usually takes about 7 to 10 days because we are getting it through the Minnesota Vaccine for Children program. And then we will be putting the word out on the website and other media forums that people will be able to contact our public health and schedule an appointment, and then we can get them vaccinated.
Are there other resources?
There's also, they can get them through their primary clinics. A number of the urgent care, if they're connected to a clinic in the same building, may be able to provide that vaccine. But like, for instance, the Essentia, the 7-day walk-in clinic, they do not provide vaccines there. Pharmacies are providing the measles, mumps, and rubella vaccine for 19 years of age and older. They are not vaccinating children.
Thank you.
You're welcome.
Yes, Commissioner Krabnoff.
Thank you, Isaac, for your education and awareness. Just curious, with the 2 cases over in Cass, maybe locally here, or if you have knowledge, do you know what protocol or what steps they're taking now that they've identified those 2 cases, and what they might be doing with some prevention, if you will? Or how are they tracking the exposure?
Yeah, yep. So both of those cases were, so this is to the best of my knowledge, again, I can't speak fully to what North Dakota, did, but both cases were interviewed. They gathered their kind of their information while they were infectious, and then, looked to see where there would be potential exposures for folks. They did determine that, both of these cases in Cass County did go to a clinic over in the Fargo side, where, our exposures occurred. And then, so those are the ones that we're following up on. They have a larger pool that they're also monitoring and making sure, don't develop illness too.
And Commissioner, Mr. Chair and Commissioner Kravinoff, Fargo Cass Public Health also set up a vaccine clinic for the public. The initial one, they received only 30 people. They were expecting quite a bit more. And I'm not sure if they have any others planned, but that's what they initially started, since there was originated 2 cases were in Cass County.
And one follow-up. Do we know when they were identified? How long ago?
They were in the healthcare on the 7th.
Right.
So, of May. So they were diagnosed, 7th or 8th.
Thank you.
Yep.
So,
Yeah, and I just kind of, I'll be around for more questions, but I think it's just kind of wanting to note that, kind of what's old is new again. And, we're kind of coming full circle on some of these diseases that we didn't typically see. And it's just a huge burden. And, I cover West Central Minnesota, which is 16 counties and about 500,000 people. So I rely heavily on our local public health partners too. So Kathy and Cheryl and Liz, and if continue to see cases like, the Journal of the American Medical Association thinks we will, we're going to rely heavily on local public health to assist with some of this monitoring. And that's going to become labor intensive.
So Isaac, I have a couple questions. The first one, and I'll just ask them both. And the first one I have is, why are people born before 1957 immune? And secondly, for young people today that are having children and they go through this how do, I don't think I've seen in today's age more than ever the concerns and questions and uncertainty of vaccines. It's just a public debate. And so for these young people, I have grandkids. I don't know if they've been vaccinated for measles. So, and I don't know what is the process involved for those? How are they notified of should they, shouldn't they, and where can they get the information to find out if it's a legitimate deal? So the first one might be really easy to answer, but.
Yeah, the first one is much easier to answer. So measles is so infectious that before the vaccine was invented and approved, basically everybody that was born before 1957 had natural disease. And so they have lifelong, what we consider to be lifelong immunity to that. And then, so that's the first one. The second one is like a multifactorial complex answer. And I'll give you my 2 cents. Again, this is me talking, not MDH per se, but I think the risk perception is changed. So a lot of folks, I showed you that picture of measles rashes. A lot of providers haven't seen those measles rashes. Well, same with a lot of parents. They haven't seen a lot of measles cases, and they don't realize how sick people actually get with measles and the potential complications for it. So the risk perception of vaccinating their child versus dealing with a disease that seems non-existent, is skewed. And so that gets to be a bit of a challenge there. I think social media, circles, I think we see, and what we've seen in subsequent, outbreaks here in Minnesota and outbreaks in Texas, is that, we talk about these vaccination rates of, 80 or 70% of kids are vaccinated. But that's throughout the population that you're looking at, and the population isn't homogeneously distributed, right? So it's kind of birds of a feather flock together. So you might have 80% of people in Clay County who are vaccinated, but you might have 20% of a particular school. And I'm not using actual numbers there, but I'm just saying what we see, anecdotally. So I think people kind of have some self-selection bias, and they talk with people who think alike, and they get fed things on an algorithm on social media that kind of suits what they're already thinking. And I think it just kind of is a compounding issue. And, and I think it's hard when we have the leader of our largest scientific agency in the country, you know, is an anti-vaxxer too. So I think that's just, you know, makes it a real challenge. I think all those things, and then about 25 others. So the good news is, I do think, you know, I showed you some rates earlier with people that are 8 months to a year and 8 months behind. Some of those folks will get caught up. Some of them will see some of this news and change their minds. Some of them were just maybe missed a few appointments. Some of them are maybe going on kind of their own vaccine schedule, even though we certainly don't recommend doing that. But, you know, it's really just, you know, it's kind of setting the seeds for, you know, large outbreaks and a bit of a wildfire of a super infectious disease.
If a person, and Cheryl, you want to comment on this too, but if a person would have received the first shot and then apparently there's a second shot that you're supposed to follow up, if they've had the first one and not the second one, does that change the severity of if they do get it? Is there any science to that, or?
Yeah, so typically they would have, if they were to contract it, it's still 93% effective against disease. So it's still highly effective. We consider someone with one dose to be immune. But if they were to be one of the folks who do develop illness after being vaccinated, they typically have a milder case and they're less infectious to others as well.
Thank you. Cheryl, did you have a comment?
Yes, I was also going to mention, you know, talking about the lower vaccination rates, that there's still a fairly large population out there that when it comes to vaccine hesitancy, especially regarding the measles, mumps, and rubella vaccine, believe that if they get their child vaccinated with that vaccine, that they will develop autism. And there is absolutely no scientific proof that they will develop autism from that vaccine, but they are still a huge belief out there. And so I'm hoping that the clinics are doing the same that we do at Public Health, but we do constant education on that, both in the schools and within our clinic and within the clients through home visiting programs, all of those things. And aside from that, I'm not sure, besides education, what else we can do to avert that. And then I was also going to comment your comment, Mr. Chair, about how people are notified if their child needs that vaccine. So any child that's been vaccinated in the state of Minnesota is registered in the immunization registry called MIC. It's the Minnesota Immunization Information Connection. And they send out text messages to parents, not just for the MMR vaccine, but for any vaccine that the child is due for. And also they have sent postcards to people. So it's very important that we try to keep that information in there up to date so that these parents can be notified that their child is due for vaccines. Okay. Thank you.
And Mr. Chair and Commissioners, anyone that goes into their providers certainly provide the vaccine schedule. So parents that are bringing their children in for their regular checkups, they will get the vaccine schedule and when everything is due. We also have a child and teen checkup outreach program that Public Health provides. And like Cheryl described, calling, texting, we have families that a lot are underinsured or uninsured. And we're calling them to remind them about getting their children in for their appointments, getting to dental appointments if at a certain age, getting their vaccines. So we are sending regular reminders to all the families that may not get to their regular provider.
Yes, Commissioner Kravitz.
Yeah, just one last question for me. Just curious on a local level through our Public Health. So what information and if any has been given to our school districts knowing, the current status of our, especially within CAS, or just what the potential is, awareness?
Mr. Chair and Commissioners, we have school nurses in 3 of the school districts, or 2 of the school districts. So Cheryl is one of the school nurses that goes out, and then we have the nurses in another large school district. So that information goes through the school nursing. But I believe the schools that do not have a public health nurse as their school nurse is also getting that information out through to their schools.
I'm in contact with those other school nurses that are not public health nurses.
Okay, thank you.
Yes, Commissioner Ebringer.
Just looking at, in West Texas is probably the counties affected there. It sounds like it may be comparable demographically to us. What was their pre-outbreak immunization numbers? How does that compare to ours? Are we better prepared, least prepared? How do we look?
So it's a little bit difficult to give you an exact, because, obviously I have access to our rates in real time. I can only take what they report with certain segments. But what I can compare, it's pretty comparable if they're not, and they might actually have a little higher overall rates than what Clay County does.
Immunization rates.
Yeah, yep.
So they were possibly better prepared than we would be right now.
Yeah, I think what, but again, that's an overall rate. And I think in West Texas, they particularly ran into the issue where, it's not homogenously distributed. So, they had those pockets of the population that had really, really low rates. And that's where it started. And so, then everything kind of snowballs. You get more and more cases, more and more exposures. And then the disease kind of finds a way to continue to progress and spread. And so that's why we do so much work right away with really trying to get on top of these outbreaks before they spread, because at a certain point, then they become, untenable and unmanageable.
Thank you.
All right, anything else?
Any other good news?
Well, I put fertilizer down and it's raining, so.
There you go.
All right, well, thank you, Kathy, and everyone. Isaac, thank you for sharing
Yeah,
information
happy to
with us.
join.
Oh,
I have one thing for Kathy, it's not
Yes.
for Isaac, but
okay.
if Kathy could stay and give us an update on public, Partnership for Health, that'd be
Oh.
great.
Yeah, I've got that report.
I don't know, but she can give a report, right, if she has time.
Just one more observation here.
Okay, yep.
We had Isaac on at the meeting with Public Health that we had this week, and I asked Kathy to see if he could join us today. This is a concern. And I don't know if we're staff-wise or anything else prepared for it, if we get another pandemic. And I know the frustrating thing about it is the parents that are not vaccinating their children, I think in many instances, are doing so because they think it's the best thing for the child. And I don't think they're prone to listen to elected officials. I think they're probably more inclined to listen to public health, but that may not be enough. If parents are out there and their kids aren't vaccinated, find a third party you can talk to who's got some qualifications. Go to your physician if you've got one. Go to your pediatrician if you've got one, and ask them hard questions. Don't say, should I, shouldn't I? Say, why should I not? Why should I? What can I do to gain the information I need to make this decision? I think if you go to somebody who's qualified and get off the internet and go find somebody who has got medical experience and somebody you trust, you're going to get the answer you need to hear. But this is a horrible thing to have break. It focuses on children. And this is, I'm one of these, I'm old enough to be, apparently, and it was a surprise to me, Mr. Chair, that I know you're in the same boat, we have an immunity. And I think I've had measles vaccine. But apparently, people born when I was born got the herd immunity or got exposed to it and had the resistance to it. But at what cost? How many kids that were born in my generation died? We've forgotten that, or were impaired for their entire life because of measles. There's a reason everybody wanted to get immunized when they first brought the immunization out, was because everybody knew somebody that lost someone in their family. We don't need to get to that point again. If parents are resisting this, please seek out qualified medical advice and ask them the hard questions you're concerned over for the safety of your child. Thanks.
All right, thank you.
I was just going to make one more comment. We've been really focusing on children this morning, which is important, but it is not just a childhood disease. This is obviously affecting adults, as there were the adults in cases in Cass County, and that. So, and I also wanted to mention that when we, as a school nurse, when we have parents that are choosing not to vaccinate their children, and that is their choice, that they're required to sign a non-medical exemption form. But I also inform them that if we were to have an outbreak of chickenpox, measles, whatever, that your child is going to be one of the first that are going to be removed from school, and that is purely for their protection because they are not protected by the vaccine.
Are there any measures being taken with child care facilities to monitor this? It's summer and school's out pretty soon, but I think child care would probably be a place where it would be a real risk.
So the child cares do follow a lot of the same recommendations for the schools as far as exclusion and vaccination. Each child care center can determine whether all of their children are vaccinated or not. They can determine that, or they can also allow the exemption letters. But they do keep updated records at their site, so they would know the same as the schools who would need to be excluded if there was, a case identified and there was exposure.
Mr. Chair and Commissioner Ebinger, we also provide the nurse consultation for child care sites. So we have 7 child care sites that we provide consultation for. If they have infants, we're there monthly. So we're looking at all of everything that's going on infectious disease-wise, or, just to make sure that they're following all the requirements that they are required to do for their licensure. We would report something if something was a real huge problem to the state licensure. But the nurse consultation gives them all the information that they would need what they need for all of their children. Some are from infants through school age. So it's a great, we have a great process here in Clay County working with those child care centers.
That's reassuring. It is relevant that I understand North Dakota allows unlicensed child care facilities. And we're right across the river.
All right. Well, thank you. Kathy, I guess if you can stay for a minute, I think. Thank you, Isaac, if you're still on.
You're welcome. Good talking to you all.
Yeah. Thank you.
Bye-bye.
Right, Ezra, do you want to?
Yeah, could you give the rest of the commission an update on Partnership for Health? We had a meeting on Friday. I didn't attend, I attended it virtually, but if you could give us an update on how the split is going with how that is breaking up.
Sure. Mr. Chair and Commissioners, and I think Commissioner Ebinger was probably going to have most of this information as well. But we talked previously about 2 counties that were leaving our CHB. So it's Clay, Wilkin, Otter Tail, and Becker. And 2 of the counties have determined that they are going to start their own CHB. That begins they needed to give a year notification. And that begins in January 1st of 2026. So Partnership for Health, we're considered the injured parties because we aren't the ones leaving. The parties that are leaving have to begin a whole new CHB. They have to do all of the initial.
Were the ones considered leaving?
Pardon me?
We are the ones staying.
We're staying, so we're the injured party, so it's Clay and Becker.
Okay.
That's a term that the state uses.
Okay.
So we don't have to start a whole new CHB. We can use the Partnership for Health name that we have. We just have to, we have all of our documents, our joint powers agreement, our other documents for order of business. We'll have to adjust those to make it for just 2 counties versus 4. So I'll be working with our county attorney, who doesn't know that yet, but thought I'd announce that just in public, so now he's obligated to work with me, just to review all those legal documents, because they're all, what we'll have to do is edit those documents, and to determine the 2 counties that are staying. So our community, our board will look different. We obviously need a CHS administrator, so that's either the public health supervisor from Becker or myself. Clay County will still provide all the financial work. That's what we've done forever with the CHB, so that will remain. We have
You
a
say that, is that like the fiscal host? Is that?
Yeah, we're the fiscal manager of all the grants. There's a lot of grants that go through the CHB. So we'll be the fiscal manager of that, and I have a financial person that does that currently for the 4 counties, so it will be just for 2 counties. The amount of work, so there's a lot of state meetings that we're required to be a part of. So now we'll only have 2 public health director and supervisor to attend all of those meetings. So there'll be a bit more on our plates to have to manage. We could spread it out before with the 4 directors, because there's monthly meetings that we have to regularly attend and other meetings. So that will be a bit more work for public health locally for both Becker and for us.
Mr. Chair.
Yes.
We did have a meeting after the public health meeting with some state officials, and I want to give a shout out to Brandon, who's on Kathy's staff and handles financials on this. He has done a remarkable job of making it clear, documenting it. There's really no acrimony among the parties, the 4 counties. This is a decision Otter Tail and Wilkin made, and this is not an affront to us. The money is being divided up, and we're identifying how it needs to be spent and what we need to do. Everybody has total faith in how Clay County has handled the fiscal responsibilities on this. Nobody questioned any of the numbers. It's going smoothly. I regret that it's happening. I think all of us do, but this is going to be a smooth transition from what I can see, just listening to the staff, looking at the numbers. Our big concerns are the same concerns everybody's got everywhere, is our funding going to remain intact? And simply because of external issues. But as far as keeping our partnership with Becker County, that's sound. Everybody's comfortable that that's going to continue. So it was a good meeting afterwards. I feel very confident that we're on top of things, keeping track of the money, keeping track of the grants, and keeping track of the needs of all 4 counties as we go into a new phase.
And Mr. Chair and Commissioners, there was a lot of latitude in regards to the division of funds for the 4 counties. So as we were working together, I ensured that we have the amount of money that we would need. So when we talk about the 4 counties, we had 2 large counties. That was Clay and Otter Tail. And there was some discussion about dividing some of the grant funds equally. So I'll just give an example. If we had a $200,000 grant, there was some discussion about, let's just divide it $50,000 apiece. And I really push back on that, because I think it's important to note that the size of our counties and the population we serve warrants that we get a larger portion, I'm just going to use as Wilkin, than Wilkin does. because they are a very small county, which much less population to serve. So just so you know, I made it very clear that we wanted to go by population, a formula. So population and social vulnerability index, those are two things that the state used to use for every grant to make it equitable. And I've received those numbers from MDH, who also works with CDC on getting those numbers. So they're very accurate in regards to the division. So that was a little bit of a, I would say, a little push with the 4 counties that we would not accept, you know, an equal split based on population. So I advised our financial person in public health that the population formula, I expect that will be used for all of the grants unless there is, unless the state had dictated otherwise. So we had some latitude in how that divided. So that was the division we're going to use.
So looking forward to 2026, any grants that are applied for in 2026, the amount of the grants that we might receive might look different than had we had 4 counties. But
Yes.
then the distribution will be totally different, as you talked about, between what Clay might get and what Becker might get.
Yes, that's correct. So as Brandon, our financial person, worked on that, he used the population formula. Some of our grants go from June to July, so a lot of them carry over into the next year in 2026. So I wanted to ensure that that was population and SVI. And then the other grants, the state will be working with us, all the grant managers will be working with us to ensure that there's some equitable process.
Well, just historically speaking, from being on here, I remember when our partnership was Clay Wilkin.
Yes.
And then it went from that to the 4 counties. And I, you know, during the whole time, I didn't hear any, you know, I thought, okay, boy, this is going great. We all agreed to join in, and just maybe a comment on Commissioner Evers. To me, something had to happen to all of a sudden have 2 of them not want to be part of the 4. And I think maybe you just addressed that. And, you know, so hopefully, you know, moving forward, we can still make things work. I think there'll be more questions down the road as far as, I don't know that there's going to be a cost change to Clay County in all of this process.
Mr. Chair and Commissioners, some transparency is there was really a push for the 4 counties to look at a standalone public health agency. Now, I'll say there are a couple in the state. Horizon in Alexandria is a standalone. So in other words, they are not part of the county system. So they leave that county system and become their own independent entity. I fought against that. I said there's no way we are leaving our county systems. Just absolutely a no from me. So there may have been a little contention on that part as well.
All right, no. All right, well, thank you for that update. Does that? Okay, all right.
Thank you so much.
We might hear a little bit more from Commissioner Eberling in his committee report, so, or you, but, thank you, Kathy. All right, next we have an approved letter to legislatures identifying Clay County's concerns with the implementation of the Minnesota African American Family Preservation Act, known as MAAFPA, as proposed.
Good morning, Mr. Chair, members of the commission. Over the last several legislative sessions, this commission has taken an active role in St. Paul, whether that's through participation at different committee hearings, meetings in St. Paul, or through letters of support. As you're certainly aware, Minnesota is facing some challenging financial times over the next biennium, and one of the areas that has been most impacted through some of the suggested legislation is social services and public health. And so today we have a letter of support specifically focusing on the Minnesota African American Family Preservation Act. We're fortunate to have Quinn, who's been able to keep this board up to date on multiple occasions about many of the changes that are being recommended through legislation. And today, before you for your consideration, is a letter that was asked for on behalf of our local legislators. We've been fortunate from the standpoint from when this legislation has come out. Our legislators have been asking us what the impacts are going to be or would be for Clay County and for our region. And so Quinn was able to put together some information. Last week, Representative Commissioner Mojo was down in St. Paul arguing and sharing information on several areas, including this. Commissioner Bear has had conversations with Representative Joy and looking for additional information, and so that letter is here before you. And with that, I'd yield for any questions.
Any comments, questions? Commissioner Mojo.
Thank you. Maybe just a background in regards to this. As you all know, the legislative session runs really quickly, as we've all been kind of challenged to address issues really swiftly. And I apologize for this not coming before this board ahead of time. However, I think the size and scope really runs parallel to the veins of support that we've had along this board for a long time, understanding and appreciating the historic nature of what the intention is of this, but particularly Representative Keeler and Representative Joy really wanted the county to act boldly and identify some of those areas for concern, and understand in the conference committee there wasn't a whole lot of support for what this, I hate to make a motion on something that's really already dated with the legislature, but because it's a delayed implementation for 27, these points are still going to be very, very valid for next session. And so for us to continue that dialogue, the SSIS funding for implementation is really going to help with this. But further, how do we, as a framework, deal with the rules if there's not a course of action for counties being in violation? I mean, that's the hard part, is we're already doing the best we can to address what the rules are, but if there's not a framework to support it happening correctly, then what? So this will continue to be really important. And again, I appreciate the chair for being open to signing a letter. And he really did feel, because we've had these discussions around this table a lot, it wasn't anything new as a point of reference.
Yeah, there's, at the start of this whole legislative session, we understood there could be some significant issues related to Clay County, and I think we pretty much agreed that Commissioner Mojo and Commissioner Krabnoff would be the two acting on behalf of Clay County, being in St. Paul as much as possible, and there was times where immediate reactions need to be done. And in this particular instance, we've had significant conversations regarding all of these things that are addressed. That Gwen did a really nice job in the start of it, and then I think modified a little bit by Commissioner Mojo. But the letter really spoke to things that we collectively here have talked about during the entire legislative session. And, the request, we received a request for this letter. And, and they wanted that letter in their hand while the session
Immediately.
in place, right?
Like in 20 minutes.
Yeah. So our administrator reached out to me, and I said, all of these things that are in this letter, we have collectively agreed upon as a commission that we should be supporting. And so with that, the letter is in their hands. And this is kind of, the action today is really reaffirming from a public record standpoint, our position on that. So I see two hands up, so I'll go with Commissioner Ebinger first.
Yeah, Mr. Chair, just an observation that's all of us, I think, agree on, but the public should know. Number one, the decision is that the tools we had in making a decision to send a letter like this were supplied by Quinn and his staff. We had plenty of information, good information that has guided us. The second part of that is we put Commissioner Mojo and Commissioner Krabanoff in a position to where they have to go in and deal with these things with the legislature and do so in a timely manner. And I have no problem at all with the way this letter was put through. As Chair put it, and he's the one that signed it, but this is information we all had. It's a position that we've all taken in the past and through this session. And I think to support our social service staff, to support our fellow commissioners that we put in a position of working with the legislature, sometimes you've got to do things in a timely manner. Having said that, I'd like to make a motion that we approve the letter to legislatures identifying Clay County's concerns with the implementation of the Minnesota African American Family Preservation Act.
I'll second that.
We have a motion by Commissioner Ebinger, second by Commissioner Bear, and I know Commissioner Krabnoff has a comment or question.
Just more of a background update. So when I was down to Capitol on Thursday, I had a very nice one-on-one visit with Senator Kupek. He had this even laying on his desk, so we went in detail on it. So.
Okay. All right. Yes, Commissioner Bear.
I'd just like to thank Quinn and staff for getting that letter out very quickly.
Thank you.
I would say the letter might have been done quickly, but the research behind it took a long time.
Yes, thank you to Commissioner Mojo for making it less wordy.
Well, I mean, again, I think, we know now that the session has come to an end and there's going to be a special session. And, ultimately, we don't know how the end result is still going to be for Clay County. But I have to admit, we've had 2 members of our board willing to be down there at a moment's notice. And kudos to both of you for that service on behalf of Clay County for being there. I know Commissioner Mojo has missed several county board meetings, for that purpose. But at the same point in time, that work was critical and that voice needed to be heard in St. Paul. So if there's no further comments or questions on the motion, all in favor signify by saying aye.
Aye.
Opposed, the same sign. Motion carried. Thank you, Quinn. Thank you, Steve.
Thank you.
All right, yes. You want a break before committee reports? All right, I was thinking if we didn't take a break, the committee reports would have to be faster. But we'll take 3 minutes.
3 minutes.
We're down to our committee reports. And today we'll start with Commissioner Ebinger.
Thank you, Mr. Chair. Last Wednesday, the 14th, I virtually attended the joint Northwest Mercy Communication Board meeting we held with the technical advisors on that. Talked about some of the pressure it's been on Red River Regional Dispatch Center, that PSAP, due to encryption that we're underway installing or implementing on the whole system. And I put a patch in place, and it's keeping the system from being overwhelmed until the transition can be made for everything to be operating at once. We also had a motion before the ECB to approve RRDC's new center to add 15 consoles at the new site that we're building, and maintain consoles at the current site that we're using. That's going to be our backup site for the time being. There's also some computer systems and records systems that are going to be implemented too that need to be approved. And all of that was passed by the board. And also, in order to make these transitions, we are working with MnDOT, Motorola, and Armor to get everything up and running. And again, the transition from our current location to the new site will probably take place over a month or two. We're going to do it a console at a time to make sure everything's operable before we put all our eggs in one basket. Okay, Thursday the 16th, attended Lake Agassiz Regional Library Board of Trustees. Probably the main issue that we've got is the Moorhead Community Center and Library Building Project update. We are still negotiating with the city of Moorhead, trying to get a lease agreement with our for our offices for Lake Agassiz Regional Library. We have not come to an agreement yet, and that work will continue. We are also going to look at alternate locations should we not be able to work out something that the budget for Lake Agassiz can afford. Then, as we discussed earlier on Friday, attended the Partnership for Health Community Health Board meeting. We had it in Wilkin County in Breckenridge. We passed a formula breakdown that Kathy described based on basically its community use and population, and we put that to a vote and it passed unanimously. I had some legislative updates, none of which were very sunny, and mostly it was just an update and not an idea of exactly what was going to happen. I think we're still kind of in that general discussion of that. We had the presentation, which we saw with Isaac, on the flu issue.
Measles.
Or measles, I'm sorry. I wish it was flu. Measles a lot nastier. Looking at this, just some of the notes I looked at, immunization is down 74% for the infants now in this, for kids under 2 in this county. And herd immunity is 94%. So we've got a little bit of a message to get out and hope that we can do that. And again, I indicated after the Partnership for Health community meeting, Auditor and Becker went into one room and they had to discuss, Wilkin, went into one room and they discussed some of the transition they're working on. And we had a couple of people from Minnesota Health remotely, and Becker County and Clay met and looked at the transition, and it is really going well. There's no major issues, there's no argument over how the formula is going to work, and at this point, very, very pleased with the work staff has put into it to make it happen. Yesterday, I had a meeting on Restorative Practices Advisory Committee. Find my notes here. We have the $500,000 grant that we are still waiting on word on, and I'll defer to Mr. Melton. We were supposed to get the word on that in April.
Originally April, and obviously I thought at least by May, and now we're getting more here towards the end of May, so
we're still waiting.
Days behind.
I think they're waiting to see how the money flows for them before they commit anything. But there were a couple other grant opportunities that Michelle identified for us that we're going to go after. And then we discussed frequency of meetings. And at this point, we're settling on, it's not just between quarterly or monthly. We're settling on quarterly, but if there are meetings that we need for the community and to bring people in, they can be called. But no use setting a monthly meeting and then not having any business to take care of. So we're going to play it by ear. And that completes my report.
Thank you. Commissioner Krabanoff.
Thank you, Mr. Chair. So we're going back to Wednesday the 14th. We had the Cascade Food Commission, well attended by the commissioners. Kind of 5 areas here we touched on. Under our new strategic plan that was developed over last summer, we now have a program called Cascade Connect. This involves education and outreach. Some people, as far as those 2 pieces, might have known this in the past as First Fridays, but it's much more than that now. But it kind of, some of the features still emulate what that was. Then also we had a presentation by Janice Sweet, who was with Great Plains Food Bank. She brought the awareness of some of the cuts in food delivery that has been taken out by USDA and the effect it may have on places like Great Plains and other food pantries throughout North Dakota and western Minnesota. There are some grants I think the state of North Dakota is going to be stepping up with. So hopefully not too much of a disruption, but more things we'll just see how things play out with the federal budget, you know, as they move forward through the summer and how that affects USDA and the programs. But certainly in my view and many others, man, these are just really a vulnerable population that's been so well served by such efficient places as Great Plains, and we'd sure hate to see them go. Then there was, along with that, kind of not so much what the legislative issues were, but more on how food pantries locally are giving us some experience of how their food pantries run and who they serve and whatnot. So we had 3 people that represented 3 different ones: West Fargo Eats, Peace Lutheran Church Food Pantry, and then Reach out of Holly. All 3 gave the types of programs that they worked with in their communities, in their areas, and really impressed or just learned new things about Reach out in Holly, how effective they are in so many areas in that community that go well beyond food, but certainly it's a big piece. Then we were given a presentation by Chandler Eislinger. She's the kind of the spokesperson for the leader of the FM Coalition in Homelessness, and she gave a quick presentation of presentation he gives quite often regarding the homelessness and hunger issues in the Fargo-Moorhead area. So it was good to hear that presentation. And then at the very end, there was a big thank you to Janice Tweet, once again from Great Plains Food Bank. She's been integral for years with the steering committee and the work that's done through the Cascade Food Commission. Janice is going to be taking on a professional opportunity job that will take her off this the steering committee work that she's been part of. So she'll be missed, but just a big shout out and thank you to her for all the work in policy development that of which many programs are now being implemented throughout our municipalities. So her work was well done, and it will be missed, and certainly we have good people in good places to kind of pick up the work. But again, Janice was just a real motivator and always good with data and information. So anyway, that's on the Food Commission. Later that day, I had the Historical and Cultural Society Finance Committee. Everything is in good shape with the Historical Society's balance sheets and profit losses, cash flows, all that. It's going in good order for now. And then also I want to mention, as part of that, once again, our Executive Director, Maureen Kelly Johnson, will be retiring after 17 years of service. Her last month is going to be in July. So anyway, we've been doing executive director search for a couple months, and we have it finally down to 3 finalists. They're all being interviewed this week. So we may have a decision by our board meeting on next Wednesday as to who that replacement may be. On Thursday, on the 15th, was my day to go down to the hill. So we had a AMC day on the hill. The whole purpose of that was AMC was trying to pull together one last effort while the Senate was going to be in the chambers and the House was going to be in the chambers that morning, that we would be there at the doors, meeting our legislators, making sure that the effect of, our presence around those chamber doors was known, how some of the shifts, some of the things that are being budgeted are going to be, we feel, very inequitable toward counties. And that it was very well planned. We were over there and we were in our place, and all of a sudden things were being canceled, and the next thing, within an hour, we had the governor and the state leaders of the Senate and the House giving their global budget targets, and one of the areas being affected was potentially having no MNsure available for adults within the undocumented community, and there was a bit of a revolt in the hallways, and they were banging on the doors of the governor's office, and it got very loud in the Capitol. So anyway, long and short of it, most of the things that we were doing really got disjointed. It was weird. That's all I'll say. And anyway, that's democracy. And so anyway, about 1 o'clock, there was kind of things had settled down, but I mean, our reps and our reps in particular were in caucus trying to figure things out. But I did really have a good one-on-one visit with Senator Kupek. He was available, and went up to his office, and we went through the African American Act that we just spoke of, and the other issues. And it was good to talk with Senator Kupek, a little more detail, kind of where our thoughts were. Thanked him for the work that the Senate was doing to mitigate some of the amounts being put toward the counties on the disability waivers. Again, we talked about the Preservation Act, and then we even had a nice little heart-to-heart about the paid family medical leave. And he's very much a proponent of it, but it was good to have that conversation to, again, continue his point of view, and from a county standpoint, the programs may benefit some, but they're hard hits on the county. So with that, that's my report of that day. And I just want to shout out, I know how many times and the hours that you spend, Commissioner Mojo, doing what we do, and it's so far beyond. I know my name gets mentioned in this, but almost everything I'm doing in conjunction with Commissioner Mojo is following her lead. So I just want to express the thanks to you.
You done?
Yeah.
All right, thank you. Commissioner Mojo.
Thank you. As I'm scrambling to write a letter to Senator Johnson about the cost shifts to get out in the next 10 minutes, so I appreciate that. Thank you to my colleagues for those comments. Certainly the work at the Capitol is not only mine, but it's the work of this entire board, and the conversations that we've had leading up to the legislative session is why we're able to articulate our position so strongly. So thank you. Again, I apologize for being gone last week, but I got a call late Monday asking for presence down there, so I do have 2 weeks of reports. On Tuesday, the 6th, I attended the Highway Tracking Committee meeting that I believe was, most of the issues were identified and mitigated at the board meeting last week. We did have further discussion with the Diversion Authority's stance on delaying road construction in Comstock. We've pushed fairly hard for them to have that dialogue with Comstock. Certainly from Comstock and Holy Cross Township, there's some concern there, so I'll attend a meeting this evening in Comstock about that dialogue. On Wednesday, the 7th, I attended all-day extension interviews. Currently, they're in the process of hiring a replacement for Mindy Grant, who was hired by the regional office, hoping that they are able to fill that position before summer programming ensues. And the 8th, I was at the state capitol. I was asked to attend the Capital Investment Committee work group meeting. They did propose and walk through the spreadsheet, but only identified their internal capital investment needs. You know, if they go with that 700 million, which I think is the target, you know, that's going to be agency only. There won't be any additional community projects included. If they go with that 1.2 or $3 billion, we do have a good chance of getting in that. You know, but then that goes to the framework of the dialogue with the Diversion Authority. Then there would be no budget capital investment bonding bill next year. So I think it's important that we communicate that there. And so that day I also, they had proposed the CPA cuts earlier in the week, which I think equates to about $158,000 cut to Clay. All of our cities had a huge cut as well. I think Dilworth and Barnesville, it's upwards of 30,000. Moorhead is 258,000. So any time we can cauterize that bleed, that will be great. But again, that was a really great opportunity. I had a long dialogue with the House Capital Investment Working Group chairs on that. Friday, I attended the legislative coordinating for both of our infrastructure requests. You know, it's a very fluid nature, so right now the meeting on the 9th, kind of the report seems quite dated since here we are. On the 12th, I attended the Rolog Seniors meeting, was invited by Joe Peterson to have members from the county come out to speak to that group. The sheriff and his deputies were there. We did have Justin from the highway department there to partake in the conversation with the Rolog group. On the 13th, as noted, I went back to the Capitol at the request of the Capital Investment Chair. I was joined by Cale Dunwoody from the Chamber. We had really great conversations with all of our local leaders, not only at the Thursday meeting, but the Tuesday meeting. This one particularly, we talked about some of the paid family, the tax decrease that was proposed for businesses. I know it was a small amount, but made sure that we advocated that position. That tax bill has not gone through conference, so that's one of the ones that we're waiting on. As if you watched last night, the House policy bill or the Health and Human Service policy bill did advance, but our allocation for the PRTF is in the finance bill, and that's being held up right now too. On the 15th, I attended MetroCog. We had a public comment opportunity on 2 different modifications. One was the 2025-2028 TIP Amendment number 6 that was passed, and then the 2025-2026 UPWP modification number 1. I appreciate the work, the vast work that's gone into that. On the 16th, I was invited to attend a breakfast. Admiral Munch was in town. The Admiral commands 20 million nautical miles of sea and is from North Dakota and was in town receiving an honorary doctorate. That was an opportunity for President Cook from NDSU to talk about all of the different arms of regional commands locally. So we did have all of the different updates. There are so many people in our community that serve in those capacities, and it was just really a wonderful opportunity to hear different perspectives from around the world. Then I attended the CAPLP Syndica. I was invited to present to their emerging leaders training on behalf of CAPLP's board on the processes of boards and the like. After that, I had a brief conversation with Administrator Larson and Quinn in regards to the letter that we'd sent and working forward. I had to give you, since you did it, I had to give it back to you. The letter that was sent yesterday, I attended the LMHC collaborative, or we had updates from the collaboratives. Exciting to note that the Clay Collaborative was able to award those grants upwards of in more amounts than they'd been able to in years past. Really great options there. Lakeland also, I think, received a grant in the amount of $25,000. And yesterday, I also attended the MetroCog TDP meeting that kind of highlights the tracking routes for MAAFPA. Really exciting that our conversations regarding the DMV have initially been heard. They're including that as part of their vision for service going forward, so we'll continue to keep on that. And then just as we've said, also the legislative session closed yesterday. There's still a lot of work going forward. One item that really does affect county boards, the new virtual reporting requirement has been changed. So once the governor signs that, we will no longer need to provide an address if we're attending remotely on that ahead of time. I know that's been a challenge for some of our smaller joint powers groups in getting quorums, so interesting to see that. And I believe that concludes my reports.
Thank you. Commissioner Bear.
Last Tuesday after board, we had the County-Owned Lands Committee where we discussed receiving a FEMA hazardous mitigation grant for a rural Glendon house. We have 4 years to access that grant. Right now it would be a 75-25 split with the local share. Hopefully comes from the landowner, but we're going to look at going after helping the landowner go with the DNR and see if they can get another chunk of money from them. We also had a solar company reach out and wanting to put a solar reach out and put solar on one of our county-owned lands. That is being discussed further, so no action was taken on that. And then we also had an update on the county-owned lands online inventory for staff to be able to access all the county-owned lands on a Pacific website. That's what we discussed there. And then on Wednesday, the 14th, I was at the Wildhorse Watershed District where they passed 18 permits and tabled 5. And we also got a list of district-owned lands in the district, finding out how many owned lands the district owns and how many acres. There's no action done on that, but we tabled discussion. They tabled discussion on that for next month. And then on the 16th, I attended virtually the Partnership for Health meeting, which Commissioner Ebbinger and Kathy McKay already addressed during this meeting. That was all my committees.
All right, thank you. All right, on Tuesday, May 13th in the afternoon, we did have a meeting where we had some discussion and preparations for discussions with Comstock regarding the Highway 2 road that goes through Comstock. It's my understanding that there is a meeting tonight. Commissioner Moschel is planning on attending. I may try to pop in as well for that one. I'd like to kind of hear their concerns as we move forward. I know our highway engineer has some real concerns about how all these delays could be lining up for chaos in southern Clay County, and that's a real concern when it comes to all these projects ending up at the very end, and the last thing we need is miles and miles of detours that would not need to be done if it wasn't for these delays. So we'll be monitoring that. And then yesterday I attended Wednesday the 14th, I attended the RRDC Budget and Finance Committee meeting, and I gotta go to my phone here for this one. I apologize. There were two issues that came before the Budget and Finance Committee, and one was on the UPS battery replacement. I reported on that before, and I think Commissioner Ebinger did as well, and we had originally approved external battery cabinet but due to a misread by the field report, the UPS vendor mistakenly replaced the internal UPS batteries instead of the external. And so, you know, and they both of those have different lifespans. The external ones were needed now, and the internal ones were like on year 3 of 5. So what happened there is that, you know, we agreed to pay something towards those internal ones for the value that were there, and then they assured us that on the quote for the external ones, we would get a reduction in that price. But that was recommended by our Finance Committee to move forward to the full board. The next major issue was the fire records, and these were both, or this was brought before through the Executive Committee. And what happens is the current company that we use was Tyler Technologies. They are discontinuing its fire record solution. And proposed transition from Tyler Technologies fire record system to the cloud-based First Due platform. So because the one entity is no longer providing the service, which is Tyler Technologies, we need to move those to that cloud-based First Due platform, which Metro Fire agencies aim to implement by the end of 2025. And then it's that one, there's a cost savings through the old one, but then there's going to be a cost increase going to the new one. So there is going to have a 2026 probably budget increase because of that transition from Tyler to First Due platform. And then we also reviewed the budget draft for 2026, and the proposal that came through, I believe, showed an increase of 6%. I know that, and then members from Cass County had indicated that I think they're taking the position they want everything to try to stay within 3%. And so there was no action, from a time period standpoint, there was no action or recommendation by the Budget and Finance Committee on the budget. Again, we're going to review it again next month in June, because ultimately the recommendation and the final decision by the full board, Triple RDC board, needs to be done by July, according to our JPA. So then I'll go back. So then on Thursday, then I attended the Lakes Country Service Cooperative meeting. That's independent of Clay County. I serve as an elected board member on that, but I do represent counties as a county representative. And the one thing of real significance there that they do is they have the cooperative purchasing. And it's big throughout all of Minnesota, North Dakota, and South Dakota, and they end up with contracts with vendors that really allow for reduced pricing, sometimes 5 to 10%. I did bring this, I'll give it to you, Steve, and we can put it on to whoever. I know that Clay County does take advantage of that, and in the past, we've also used them as a, when we were dealing with health insurance until we went out on our own. I think there's always the option, and we did get an update on health insurance renewals that are going on there. They always seem to add new ones, and a few drop out. It's very typical, and there's some that they don't even want to quote because the claims are so high. So that was that. And then on Friday, the 16th, We hold that every Friday morning. We have that through the chamber. We have the public policy, and it's basically an update on where things are sitting with the legislature on our legislative asks primarily for the diversion stuff. And that one, Commissioner Mojo, and Kale were both at the meeting that she talked about in Fargo, but obviously there was really not much going on other than we still stand by what we're hoping for, and we're just in a waiting mode now. So that concludes my report. Steve.
Thank you, Mr. Chair. Last Tuesday, I participated in the county-owned lands meeting that was previously discussed. I also was able to catch the tail end of the County Road 2 Comstock discussion that has also been spoken on. I met with Mr. Melton on a series of county issues that afternoon. On the 14th, we had county management. We talked about the legislative session, budget timelines that this board approved. We heard updates from IT and risk management and HR. We also spoke, we're looking at a county appreciation picnic on June 24th. And also talked about this year at the Clay County Fair, Clay County Government Day is going to be July 11th, again from noon to 4 time frame. That afternoon, I met with Richard Hanks, the government relations staff member from White Earth Nation. He was there to learn more about Clay County. And so we talked about Clay County and some of the ideas, discussion with the casino. That afternoon, I met with Dan Molly, Peyton Mastera from Dilworth, and also Derek LaPointe. Again, on the discussion with the casino, we've been having initial discussions of putting together framework information for the committee that's going to be established in discussion with the casino. And so starting next week, our next meeting next week, we've engaged legal counsel, Mr. Melton, and also representatives from the city of Moorhead and Dilworth as we put that framework together prior to bringing the group together. And so on the 15th, participated in MCC JPA prep meeting. The meeting is going to be held this week. On the 15th, also met with Joe and Mark Sloan in regards to our capital improvement documents that we were going to be bringing forward to building committee here in the coming weeks. On the 16th, had a flood mitigation, our weekly flood mitigation meeting with Jason Benson, Commissioner Mojo, Lisa Bodie were present. Not a lot of movement again that day, but we did meet. Also met with non-secure detention with Quinn and Commissioner Mojo. On the 19th, participated in the MetroCog Transportation Plan meeting. Again, as was shared, they had come up with two different scenarios, and they went back to the public for their input, which ultimately came to the draft document that Commissioner Mojo talked about. They're still working through a series of issues, including what that's going to look like around our 15th Avenue DMV withdrawal management, but hope to have something out soon. On Friday, met with Darren and the sheriff on a series of different things. And also on a day of maybe not super great news, I did talk with James yesterday, and he received notification from the state of Minnesota that they were extended for their Bryn Justice grant. And if you recall, that's essentially it's $125,000 for the next year. He's received that grant since I think going back to 2018. That pays for 2 positions or parts of 2 positions in the non-secure department. And so he's going to be before this board requesting your permission to accept that extension. If you recall, going back to the 2025 budget, he had anticipated not receiving any funding from that. And so, again, that will be a positive impact for.
Wait, I thought you said not so good news.
Oh, did I say not so good?
You did. I was like,
sorry.
what?
I meant to say in a day of not so good news, here's some good news.
Oh.
So,
Okay. Just want to clarify that.
Yeah, all right, thank you. Yeah, and so that was great. The grant goes through, the extension goes through June 30th of actually next year. And so not only is there a positive impact for 2025 budget, but also the 2026 budget. And that concludes, just the last thing, we do have upcoming meetings this evening. MnDOT is going to be having the Highway 10 pre-design open house at the DGF Elementary School. There's not going to be a presentation, but the MnDOT officials will be there to ask any questions about what that pre-design the design will look like. So that concludes my report. In Dilworth, yes.
All right. Are you finished?
That concludes the report.
Brian, anything for us? No. Darren?
Most of that's been covered already. I attended the Lance County-owned committee meeting on the 13th. On the 14th, I was a part of the management meeting as well. On the 15th, I participated in the MCCC HR payroll group, and then was working on the Department of Labor investigation that we have ongoing right now. That's been taking a lot of time. On Friday, the 16th, I did the IT director's evaluation and had a meeting with the sheriff as well on a personnel issue. And on Monday, I worked with more on the DOL investigation and attended a RFP meeting with MCCC. So that concludes mine.
Thank you. Sarah, anything for us? All right, we're adjourned. Did we have